All right, we'll go ahead and get started. Good evening and welcome to another Capital Live event brought to you by Spotlight PA. I'm Christopher Baxter, Executive Director and Editor-in-Chief of Spotlight PA, and I'm so glad you've joined us this evening. For those of you who are new to our work or programming, Spotlight PA is an independent, nonpartisan newsroom producing investigative and public service journalism about the state capitol and urgent statewide issues. Tonight is a special night and frankly week for all of us because this week is Sunshine Week, a time to call attention to the importance of transparency and responsive government. These are two ideals at the heart of Spotlight PA's mission. Our state and local governments exist to serve our communities. We pay our taxes each year, and in return, we the taxpayers have a right to know what our government is doing, how it's spending our money, and whether we're getting the services we deserve. But these days, there are fewer and fewer journalists on the front lines, keeping the government honest. And when officials don't face questions or requests for public records on a regular basis, they increasingly lean toward the side of secrecy over transparency. Making matters worse, state and local governments have vastly more resources than members of the public, allowing them, when they wish, to fight requests for information in court, often using our own taxpayer dollars, knowing full well that most requesters don't have the resources to fight back. And that's why Spotlight PA and many of our partner newsrooms are forging creative solutions to shift the balance of power back in favor of you, the taxpayer. Tonight, I hope you'll join us in supporting this vital work. Our work is driven by a deep sense of public service, and it's powered by you, our readers, and our members. None of our work, this event, our many newsletters, our investigative journalism, our public service initiatives, none of it is possible without your support. If you're already a member, I want to say thank you. If you're not yet a member, please consider joining us now. As a special bonus this evening, all contributions made will be matched dollar for dollar. That's double your gift by the Benter Foundation in Pittsburgh. With your support, you can power some of the most impactful journalism in Pennsylvania and ensure we can continue to provide it as a public service at no cost. So I'd like to pause here a moment and ask anyone who has the means to please make a gift now at spotlightpa.org/donate. We need just 15 gifts this evening to break even on this public service event. And don't miss your chance to have your gift doubled. Again, you can make a gift now at spotlightpa.org/donate. A few housekeeping items. We are recording today's event to share with those who couldn't make it. Thank you to all who have sent questions in advance. If you have not yet asked a question, you can do so using the Q&A feature right here in Zoom. Just click the Q&A button on the bottom toolbar, type in your question, and we'll get to as many of those as possible. And with that, I'd like to turn things over to today's moderator, Spotlight PA's own Ed Mahon, to take it from here. Ed?
Thank you so much, Chris. I'm really excited for tonight's event. And first, to introduce our panelists. Up first, Brett Schultes is an investigative reporter with LNP and Lancaster Online. Brett previously worked as a health reporter for WITF for over 5 years. That's the NPR station in Harrisburg. His reporting revealed systemic abuse of people with mental health conditions at county jails in Pennsylvania. He was also a regular contributor to NPR. Josh McGee is an investigative reporter with MindSight News, where he covers the intersection of criminal justice and mental health with an emphasis on public records and data reporting. He's based in Chicago, and his stories have been featured in newspapers across the country. And last and third, Terry Mutchler was the first executive director of Pennsylvania's Office of Open Records, which was created by the state's 2008 Right to Know law. She is now chair of Obermeyer's Transparency and Public Data Practice. A key portion of her practice is devoted to helping journalists obtain public records in real time. She represents a range of other clients, including life sciences companies and medical marijuana companies. Thank you all so much for being here, and thank you all in the audience as well. Everybody on this panel spends a lot of time fighting for transparency, pushing for access. That's our job. But transparency matters for everyone. Maybe you're trying to understand how to best care for yourself or a loved one. Maybe you want to know if a nursing home, child care center, or addiction treatment facility has had problems in the past. Or maybe you want to understand if a new initiative like a suicide prevention hotline or medical marijuana program is working well, and if it's working for everyone. So we're here to help. Our goal tonight is to give you some useful tools, techniques, and ways of thinking about these issues. So please send us your questions in the Q&A section down below, and we'll get started. So Brett, You've reported extensively about the conditions at jails and prisons for people with mental illness. Can you describe what is the big picture problem happening?
Sure, Ed. Yeah, I think the broadest picture that we talk about here that needs to be the foundation for understanding this is that we have a behavioral health system in Pennsylvania, like in much of the United States, that really requires the consent of an adult to provide care for that person. And at first blush, that sounds perfectly logical and it sounds like an unmitigatedly good thing. Of course, you would want to get a person's agreement before you provide services for them. But in fact, what happens is for people who are the most severely ill, we're talking about people who may be having hallucinations, who may have paranoid schizophrenia, who may be experiencing delusions, or whose moods are far beyond the realm of what we consider, normal because of a mental health condition. Those people often don't get the help that they need in a timely fashion. And then what happens is that simultaneously, while we have that behavioral health care system in place requiring consent, we have a very different standard in place when it comes to the law enforcement side of our policing and our government. So meanwhile, that person is left to decompensate, to get worse, in other words, until they hit a point where somebody calls the police. And now a very different standard is put into place. Now that person must comply, or else they will use force. And that's where we see the first dangerous intersection where police encounter a person with a significant mental illness that unfortunately even sometimes leads to deaths of people with mental illness, not to mention sometimes police can be injured as well. Much more commonly though, what happens is a person with a significant mental illness ends up in jail, where they're much more likely to end up there for longer because they can't make their bail, don't make their bail, and they're much more likely to end up there for really, really sort of insignificant things as well. Once inside jail, now we're talking about the scope of my story, which really shows how, because that same idea that a person may not be in a position to understand the world around them in a really coherent way and to comply with orders, they often are treated in ways that are part of the corrections, law enforcement, their model, but they're much more frequently the targets of things like pepper spray, stun guns, restraint chairs that lock a person into a chair and keep them from moving, other types of physical force that can really traumatize any person, and that also can also lead to the risk of injury and even death. And we have, cited some instances where people have died in Pennsylvania county jails. So that's that's the broadest picture of you, and I'm happy to go as specific as you want. But the top line takeaway from our story was quite simply that in the records we looked at, a significant number of people, about a third of the records we looked at involved a person who was what we designated as in crisis, meaning they either had a known mental health condition that was listed in their records, or they were exhibiting one of three behaviors that were a sign of crisis. And those people, such as and just for what it's worth, trigger warning that this is a conversation that's partly about suicide and self-harm. A significant number of people engaging in self-harm, suicidal ideation, or suicide attempt, and were responded to with pepper spray, stun guns, restraint chairs, and other physical control measures. So that was our main takeaway.
Yeah. And just briefly, what were some of the challenges when you're trying to describe, I mean, big picture challenges you encountered trying to reveal this information?
The challenges involved the fact that none of this information is public. So initially, this story came about because I saw this play out in one particular county in Pennsylvania. A person who had a significant mental health diagnosis ended up in jail where she was mistreated, and we reported on it. And then afterwards, somebody said to me, multiple people said to me, this, it's good that you reported that, but this happens all the time. This happens every day in jails. And I said, that can't be right. And so I started looking into it. And now the state does post aggregated information on uses of force. So it'll tell you how many times a year it used pepper spray, stun guns, et cetera, et cetera. It'll tell you how many times a year, it deployed lethal force, aka shot someone, which is not common in prisons. But so it'll tell you that, but it won't tell you why. It won't tell you why, and that's what's important. That's where we had our biggest challenge was making sense of these raw records that varied so much from county to county because we lack a lot of systemization on the county jails in the county jail system. So we had to make sense of all these raw records to determine what was leading up to those moments when corrections officers were using physical force on people with significant mental health conditions.
All right, sounds good. I want to turn back to some of those issues as well. But Josh, I want to ask you about, you recently reported on a national suicide crisis line, its rollout in Illinois, and whether that new 988 number would lead to change. What did you find, and how did you find that information?
Yeah, so back in July, there's this big moment for mental health, which is what we cover at Mindsight, completely mental health. There was this moment where the 10-digit number was changing to a 3-digit number. And basically I had done some reporting on the National Suicide Prevention Lifeline, but nothing kind of in-depth or investigative. And I just kind of wanted to know what kind of data existed, what could I learn about who uses it, how it's used, and all of these things. And the company that takes care of them, Vibrant, keeps all of these records kind of in a quarterly thing on their website that's open. And basically I was playing with some of the records and data they had, and I saw that Illinois was at the bottom. Of course, you guys are on the East Coast, you don't have the great love that I have for Chicago and Illinois. Seeing us at the bottom was very confusing to me, but I knew that it was speaking to a bigger problem. I wanted to know what this problem kind of originated from, what was happening. And basically, I called up the people at Vibrant, talked to their data guy. I talked to people who are experts on just how this lifeline and things had worked. And basically the big deal here was, there's not a lot of call centers. There's not a lot of call centers in Chicago specifically, which was kind of the assumption that I was leading with. Like if it's at the bottom, most of the calls are going to come from a big city. Chicago is huge. So, it was kind of plain for me. But once that happened, I wanted to know, well, what do people use? So I started to talk to psychologists, psychiatrists, try to figure out, and it was what I would assume. It was 911. People are calling 911. So from there is where I really kind of dug into the public records request. And I wanted to see, where are people calling from in Chicago? How many people are calling? How often are they calling? What are they calling for? So basically, I filed some public records request for the city of Chicago through what's our dispatcher, the Office of Emergency Management, to just grab all of the calls that were mental health related and figure out what we could find out. And one of the things we figured out is that 193 calls are being categorized in what is mental health kind of categories in Chicago. And that seems like a lot of calls, but it's kind of hard to put in perspective where it is. So one of the things we did was we grabbed we geocoded the data to break this down by zip code to see where they were calling from. And I've done a lot of reporting as a neighborhood reporter in Chicago. So I was able to see, this portion of the South Side, which is very elderly, is very Black, is very elderly and Black, but it's also kind of in a higher income area versus some of the places on the North Side, which also I know have a lot of social services. So I was seeing kind of exactly where these calls were coming from and what they were for. And one of the things I started to wonder was, okay, well, the big thing here is if we need an alternative response, what's the problem with our response? And one of the things we were finding is that some of the time, I'm not going to say a lot because there's a lot of these calls, police are responding and they're using force. So when we started to dig into this, we basically filed a public records request for use of force reports from police. Whenever they use force, when they were arresting someone, it could be a tackle, it could be a baton, it could be a taser, it could be a gun, it could be non-lethal force. And basically I connected those two data sets that I got from public records requests to find when people were making that call, it was getting identified as mental health related, and then police were coming out and using force. And basically I took those and I started looking at the records for things like for what kind of force was being used if they were using these tasers. And we found out there it wasn't a lot of fatal force. They weren't coming and shooting a lot of people, though it does the numbers do say about 1 out of 5 fatal shootings are someone with mental health crisis. That wasn't exactly what was happening. Instead, we were seeing these kind of violent incidents ending in arrest. And when we started breaking that down, we found 147 uses of force against people with mental health in the last 2 years. And then when we looked at it, 93% or 2 out of 3 were the uses of force were happening against Black people. So it was showing that kind of disparity of force. But one of the things that really kind of stuck out was along with this was this kind of RD number in the data, which basically signified that someone went to jail after the force was used. And that's kind of where we got to the real story that of what was happening, which was one of these incidents was somebody that we follow is the Owens family on the west side of Chicago, who basically a grandmother comes outside, she sees her grandson, he's acting weird, he's not talking, she doesn't know what to do, and she basically panics. She runs to the house and she gets to that situation. I don't know what to do, I don't know who to call. Let me dial 911. She's not sure if she called 911 or 311, but either way, police came out. And basically there's this moment where they're trying to get him to go with them. Like she's asking for an emergency hospitalization to take him, get him some help so he doesn't hurt himself. And they're trying to get him off the porch to kind of get this to happen. But when you read the report, you start to see all of the things that could be kind of flustering for someone who's in a mental health crisis. There's about 13 police officers, the lights are on, there's ambulance there too. And basically they're able to get him to come down by playing with a basketball. He's got a basketball court in the backyard. He likes to shoot around or whatever for fun. And they entice him to come down. But as soon as he steps on the concrete, he's ambushed, but I don't want to say ambushed, he's taken down by about 5 cops. He hits the pavement. His grandmother hears the tasers go off, and this kind of violent arrest happens. So it just kind of laid the groundwork of, there's a reason for this 988 hotline. Eventually they want to have mobile crisis responders, but, it's not quite at that point yet. But just why the need for this, and it was kind of revealed in these numbers and this data.
Yeah, that's really powerful. I mean, both of what you and Brett are talking about is using this data, deep analysis, and then also these powerful personal narratives as well, these personal anecdotes. One question I have for you is how do you, when you're going after this data and then when you're reporting it out, how do you balance, patient privacy rights, or how do you deal with that, or patient privacy concerns in your reporting? Brett, then Josh, if you want to just weigh in on that.
Well, I think the first thing is kind of interviewing, making sure you talk to people, you tell them honestly and upfront what you're doing, especially about, something like this. But, I wouldn't use anyone's name or anything like that without having that permission. So that's like my major input on that.
Yeah. And what are those conversations like? Some of those initial conversations you have when you're explaining what you're doing and how you're going to go about doing it?
Yeah, I mean, I think that I try to be real about the journalism I do. I'm trying to highlight issues that I know are disparately affecting people of color, people who are in poor neighborhoods in the city of Chicago, and I try to meet people on that level that we're not just we're talking about an individual moment and an individual person, but like they know that this is happening to other people. So my goal is kind of to help illuminate an issue. So it's really trying to get them to understand that's my focus is not to hurt or do some gotcha journalism. It's to highlight an issue that I think is appalling.
Yeah, appreciate that. Yeah, Brett, how about yourself?
Yeah, I mean, with our investigation, and I do encourage people to just go to witf.org and I know you guys shared the story in the link there, and then scroll down to where the map is, where you can see some of the actual records that we looked at. That's a good example of the kind of data we were dealing with, these records that were sometimes handwritten by corrections officers or typed in by officers that may include the names of people who are in the jail. They may include the names of the staff at the jail, the guards and other workers there. And the level of personal information available varied so greatly from county to county. We had counties give us completely unredacted records, which was nice. And we had other counties redact a lot more of that information. Sometimes they imperfectly redacted it as well, so you could still see who what a person's name was. But basically, our guiding standard here was that if we didn't talk to the person for the story, and if there wasn't an overwhelming journalistic purpose to put that person's name in the story that outweighed the potential downsides of sharing someone's name, then we just didn't use it. We actually we proactively redacted the stuff that we put on our story, even beyond what they did, because we just decided, you know, it's not, if we're going to include someone's name there, we should call them first. So we were actually very nice to the county corrections officers and staff who were there, in that many people could have been just very arbitrarily named in these records, and we sought to avoid that, because I do think that there's a responsibility that comes with having a platform to publish these records on a pretty wide scale. And so, yeah, I mean, generally speaking, that's what we did. Just to be clear, it's not we're not talking so much about patient records as we are just person records, prisoner records, but also sometimes medical records would get swept into those reports as well. So you just had to kind of use a case-by-case basis. In the case of Jamal Crummell, a man who had a serious mental health condition, but who was otherwise healthy, and who went into Dauphin County Prison in, I want to say, September of 2021. 45-year-old man. He went into the prison otherwise healthy and died a few months later. We, especially given that he was no longer alive, we pretty much published a lot more records related to that case, in the hope that it'll lead us to have a better understanding of what actually happened there.
Yeah, that makes sense. And Tara, can you offer some insight into how PA's current laws balance the privacy of patients with the right of citizens and journalists to understand how their government is working?
Sure, happy to do that. And also, I just want to say for the folks that are tuned in here, it's actually exceptional and remarkable that Josh and Brett were able to obtain the records that they used to do this analysis. And I think it just speaks to the quality of their skill sets, and in order to even get those records, because by the time somebody comes to me on these, it's just a legal fist fight to get basic public record. And so I think a lot of times what you have in the Commonwealth of Pennsylvania, I mean, obviously, if you're filing to get the mayor's, health records, you're not going to get that, or your neighbors or something along those lines. But there is information, as these gentlemen just demonstrated, that is obtainable related to both aggregate data and some of the specific data they had, that they were able to get. One of the, I can't remember which of you had mentioned this, that you were able to get handwritten notes from prisoners. That in and of itself ought to get, from guards, that in and of itself ought to get you an award. I mean, that is remarkable. And also, I think it speaks to a little bit of a change in the Commonwealth related to, I think that there is, I'm starting to see, trickles of what used to be just absolutely sealed off records actually being released under the state's right to know law. I mean, a lot of times when an agency gets a request, they want to tell you, some of the big overarching exemptions under the law. Obviously health records can be one, not in aggregate data. They want to say it's pre-deliberative. They want to say it's investigative. And so understanding how to write those requests in a very specialized way will help you get further into the door to get those. Privacy in and of itself is only hooked to, there's no per se invasion of privacy exception under the law and under the right to know law. But it's linked to other exceptions within there, like the health records, the DNA records, the RNA records, things like that. So it's when you're dealing with health records in the Commonwealth, you really need to know how to navigate to obtain them, because it's a tricky thing. And instinctively, if you ask most people on the street, they'd be like, no, reporters shouldn't have health records or no report. But then when you actually work with them and be like, okay, well, should reporters and the public have aggregate data on COVID numbers? Should reporters have the data that Josh was just talking about, or that Brett was just talking about? And then when it becomes personal to them, of course, they're like, well, yeah, in that regard. But the initial reaction, I'm going to say 8 times out of 10 is, no, you're not getting these records.
Yeah.
That's the initial reaction.
And then you talked about the COVID data. I mean, you represented LNP Lancaster Online, I believe, in a case where they were seeking COVID-19 death data for zip codes in Lancaster County. Can you explain what that dispute was about and how that was resolved?
That dispute was about a big fat waste of taxpayer money. And that's about as plain as I can say it. As you can tell, I'm already like trying to get my blood pressure to go down, okay? Because under the state's right to know law, aggregated data is public record. You're not going to get to know the names of the people that had COVID in, you know, whatever the Lancaster zip code is. I used to know them all off the top of my head almost. But you know, you're certainly going to understand in this zip code, it's, you know, here's the numbers in this zip code. And the Department of Health, which I repeatedly do battle with, and I think a lot of people do, is, you know, took this all the way up to the Commonwealth Court. And then we were able to work with one of their attorneys, and we were able to garner the data. However, having said that, after, you know, a great deal of money, I would say, in terms of public records, you know, that LNP devoted to obtaining that, within a couple of weeks, Department of Health came back with the same argument against other requesters. So, you know, look, aggregated data, black letter law. This isn't, you know, me giving an opinion. The law actually says that aggregated data is available. So I do get a little frustrated about that case.
Yeah, I appreciate that. And Josh, I mean, you report extensively on mental health issues, criminal justice system, jails. Is there anything that you think the general public might not know about mental health or healthcare, mental health, and, you know, criminal justice and jails?
Oh, yeah, you know, I think like one of the things that, you know, I've only been on this beat for about 9 months now. You know, one of the things that I keep learning about is just kind of how often people with mental health issues are kind of going through this system and ending up in kind of recidivism because of this. But, you know, as we talked about, we were talking about how just generally a mental health crisis can end in arrest. But, you know, lots of people end up in jail. And, you know, that's this trigger warning. This is one of the places where that has a very high suicide rate. It's going to be higher than a prison. And these people are not convicted of anything. So this is a place that's, you know, it's a very harsh place to be in, especially when dealing with any kind of mental health crisis or mental illness. I've also seen, you know, the same thing as people not wanting to go to, you know, a psychiatric hospital either and preferring jail. So it's a real hard system to kind of navigate from the mental health assessment, because there's not exactly a great place or easy place or easy solution for these kind of issues.
And then I also wanted to ask you, if you know you're in Illinois, I'm curious if you can offer any insight into the open records law there, what's been good about it in your reporting, and what's been you know, maybe weaknesses of it.
Well, I've heard that, you know, we've got pretty decent access just from talking to people at different cities and how their public records are. You know, I couldn't get use of force records specifically for California. So they have laws that are changing, but, you know, it was readily available for us. You know, I don't think they knew that I was going to combine these two data sets to do this kind of analysis, but, you know, the laws have been pretty well on my side for at least Chicago Police Department. But you
if
know,
I could interject there, Illinois was ranked 50th in the nation by the Freedom of Information Coalition in 2000 and in the early 2000s. I was actually Illinois' first public access counselor under Attorney General Madigan. And we were able to rewrite that law. And Illinois is now one of the strongest laws to obtain, stronger, not strongest, but stronger laws to obtain public record. And certainly Josh knows his way around a request.
Well, thank you for your service. Obviously, I couldn't do any of this without you then.
And then, so I'm sure Pennsylvania will be number 2 soon, right? I'm sure we'll be.
Well, they were, when I moved from Illinois to Pennsylvania, Illinois was 50 and Pennsylvania was 49. But the change in the law, in Pennsylvania has it now ranked by the Freedom of Information Coalition as high as 14. And the reason for that is because of the Office of Open Records, and that being an independent binding, they issue binding decisions unless someone goes to court. So, both and they're similar states in many ways.
Yeah, that's great. I appreciate that. And Brett, I want to talk to you about what are some of the ways that Pennsylvania's right to know law can help, or has helped you, or do you think it can help others when they're covering healthcare issues?
Right. So, first of all, there are something like 20 exceptions to what's going to be available under open records law in Pennsylvania, and among them are medical information. So when we talk about healthcare issues, there are many entrance points, as long as we broadly define healthcare is outside of a person's medical records, and that includes aggregated data. That also includes things like I was listening to Terry talk about the Department of Health. We wanted to know, this is going back a little ways, back to maybe 2019 or 2020, just something as simple as what the this is really on your beat now, but something as simple as like what were the main things that people were citing as their main reasons for wanting to get medical marijuana cards. And that was something that we had to fight quite a bit to get it, but we were able to access that aspect of it as well. We face multiple challenges here. Health systems, anytime we have anything that has been privatized, such as our behavioral health system that used to rely on a system of state-based institutions, not that I am encouraging us to go back to that system, but the community-based system, the current system that's called community-based, means that fundamentally we have private entities often performing the final conduit of delivery care for people. And so that's yet another area that poses challenges for seeing clearly what's going on there. Now, certainly there are also state facilities. There are also, available audits and inspections of, facilities as well that we can use to kind of break open the hood and see what's going on inside health systems and see what's going on inside behavioral health providers. If there's anything you wanted to add on that front, Terry, feel welcome to jump in. Otherwise, I do want to make sure I talk about the records we got from the county jails, which is a bit different, but maybe now's not the time.
Yeah, no, I think that was sort of next question. What if you wanted? That's one of the questions. You sent right to know requests to a lot of counties. How did the responses vary among those counties when they were giving you those records?
I'm so excited to talk about this, and I'm glad that Terry found it to be kind of unusual that I was able to get these records, because I do think that there's a little bit of a lesson sort of burrowed down inside of this, which is in this case, so there were 61 facilities in Pennsylvania that I requested records from. These are county jails, these are county prisons. Some of them service multiple counties, and the lawyer at the Pennsylvania News Media Association I worked with, who all of you know well, she said, hey, the law is going to be a little bit not on your side here if they claim some of these exemptions, meaning not that I shouldn't have it, but just meaning that it might be a little bit tough to argue that argue my way past some of the exemptions. Now, basically, I filed right to know requests with all of those county facilities, and she was right. Some of the county facilities said that this would threaten public safety, or that it would threaten staff worker safety, building safety, or they said you can't have these because of an ongoing criminal or non-criminal investigation. And these are all super common exemptions. And so, the thing I took out of this is twofold. It's if you really can kind of explain to people what you're doing. And I was very transparent about what I was doing. I said, like, this isn't a fishing expedition to just find out what's going on in, Dauphin County or just in Perry County. What I'm trying to do is build this set of records that's a broader look at these issues that you guys all admit are going on here and that you've all told me about multiple times anyway. And so I think as a result of that, a certain number of counties, 25 to be exact, played along completely and granted my request. They just gave me what I asked for to varying degrees. And that is, again, those records written by corrections officers that show the circumstances around which they used physical force on an inmate. Now, so again, my takeaway here being you just have to ask, even if even if you think that there might be challenges to getting it. Now, unfortunately, virtually every county that denied my request was able to win in OOR court. That means that I appealed, I took it to the Office of Open Records, and I lost. So I don't know if anyone will ever do this again anytime soon, because I think the lesson to counties is, if you don't want a reporter to look at what's going on, just appeal to the OOR and you're probably going to win. But I am very grateful that a lot of counties did grant my request.
Yeah. And yeah, Terry, I mean, what advice would you have to someone who's trying to navigate Pennsylvania's right to know law?
A couple of things. First of all, I think that one of the things that Brett has said, and I believe Josh said this as well, is being transparent in what you want. Sometimes, reporters, and I used to report for the AP, you think you kind of want to couch what you're asking for so they don't know. No, they know what you're after, particularly if you're after a smoking gun, I would say my top advice is the first thing to do is call the agency and see if you can get the records without a right to know law request. Work with a source, work with whoever you can work with, explaining what you want, and try to not use the law. Because as Brett just said, there's a lot of exemptions, 30 to be exact, that can be used to deny you access. The second thing is, when you're writing a right to know law request, do not write a thesis paper. You have to be brave enough to write 1 or 2 sentences of what you want, because I assure you, having been on the government side, the more words you put, the more some lawyer is going to be the one using those very words to deny you. So you've got to be concise. You've got to be accurate in what you're in the way that you're asking for the records, and be willing to work with them. The other thing I would say is you got to stick with it. So many times in a deadline-driven world, when you ask for a request, we know by the time you get the records, you're on to something else. But in order for agencies to understand that you are going to be the type of reporter that is not going away, even if you're not going to use that story or those data, file the appeal and appeal that, because I can't tell you the number of times that not all agencies, I really do applaud the 25 that gave him the stuff that he got, and also the use of force stuff that Brett got that Josh got in Illinois. But you really got to stick with it. And the last piece of advice I would give is this: if you know you're going to be doing one of these stories, think of it in a short term, medium term, and long term. Separate out what you know you're going to get from what you might get. And the third aspect of it is your wish list that you probably will never get, and kind of understand how to time those and file with the agency. But as a final point here, I think that sticking with it and also recognizing that the right to know law is never going to take the place of a source.
That's great advice. So yeah, we have a lot of great questions. We're going to dive into those, but first I'm going to share some of my tips as well. We have a cool little presentation. It'll be like 2 minutes, and then we'll get into questions. So everybody should be able to see that now. Vital data. So, I've been using the right to know request. I think I filed like close to 100 RTK requests last year, did a bunch today for a story I'm working on. And here are some of the tips I have for how to win an open records fight. So one is, remember that you can win. Don't be intimidated by fancy legal arguments. I'm not a lawyer. I don't try to be one, but when you're filing your appeal with the Office of Open Records, who handles most of these appeals, I just try to provide whatever evidence I can, any information I can about why I think this should be released. And then I often, leave it up to the Office of Open Records to analyze the law and make a decision. Number two, this is probably the most important one, is get your appeal in on time. In Pennsylvania, you have 15 business days from a denial to make your appeal. And in Pennsylvania, the burden is on the agencies to prove why records shouldn't be released. And so, you can win on an appeal based on that, because based on the agency failing to meet their burden. And you don't necessarily need to make additional arguments or provide additional evidence. And also, sometimes when you file the appeal, the very act of doing that makes the agency take a closer look, and then they will be like, we can give you this or we can give you that. So that can be useful. Consider mediation. This is something I've done a few times. It's been successful. You meet with somebody from the agency and then somebody from the OR, usually in a virtual session. And the rules are, it's like you have to agree to some confidentiality of the mediation sessions. But in exchange, you have a chance to say, this is what I want, and this is why I think I want it. And then the agency can come back and say, we don't think we have exactly that, but we do have this, and we would give you this. And then you can come to an understanding. And I got like, there's a case where I would have had to like go through a filing cabinet and get, stacks of paper. But instead I got this very useful big database. That was good. There's this link here to check out the big index of open records cases. It was about 138 pages last time I looked at it, which was today. But it's got, you can just do a control F search for like email specific, and you can just cite some of these cases as you're going through the process. Number 5 is ask for more time to respond. This is, sometimes agencies will submit their argument at the very last deadline during the appeals process. So you can just say, I want more time. One time I was on jury duty during an appeal, and so I asked for more time to deal with that. So, just, reach out to the OR if you have questions and if you want more time. And then I have a bunch of resources here. We'll have them available to the audience as well. But these are all really useful. I highly recommend each of these. And you can always contact me if you have any questions. And now I think we'll get into some questions. All right, so the first one is someone, and I think Terry might be in a good position to answer this, but someone wrote to us and saying, hi, sadly, my brother died unexpectedly last year in Hazleton, Luzerne County. He lived in a personal care home. My siblings and I want the written records of what happened that day to my brother in the personal care home. I understand in Pennsylvania, unless a deceased person has an executor of their estate, the family cannot obtain the medical records from a personal care or nursing home. We siblings have obtained the medical records from the hospital my brother was taken to, but we cannot get the written record of what happened that day in the personal care home. Can we ask for the report of what happened that day via the right to know laws, and how do we do it properly? Do you have any?
Well, first of all, obviously, a deep expression of sorrow. Any time a family member is experiencing something like this, it's, the first thing is the grief, of course. Here, I think that probably one of the quickest ways to get this material would be when it was a sibling, when the sibling was committed to the personal care nursing home. I am certain that someone had to sign for him to be entered there. And that person would certainly have a right to obtain, I'm assuming it's another family member, but they would have a right to obtain the records. The right to know law probably is not going to help you in a quick or otherwise, fashion in that. You can try it, certainly. The third piece I would say is, I am unfamiliar. I'm not an estate attorney, so I do not know whether it is legally accurate that one needs to obtain, one has to be, an executor or to obtain that material. But in a situation like this, if they were in a personal care home, perhaps they had a guardian, the guardian would be fully capable of doing this. whoever signed them in with permission to the home. And the third component would be to to talk with a lawyer to simply get to, even if he did not have a will, the court can appoint someone as the executor in those situations. And if it's a sibling, I think that would go fairly smoothly, and to obtain this information. You could try the right to know law, but I would be curious actually to see what they say under the right to know law. And also, here's what I want to say. In what world does the personal care home not want the family members to understand what happened to a sibling that died? That's where I start. And, take the legality out of it. Like, where's just the common decency? But I think in these situations, they're very afraid of lawsuits and litigation, things like that. But it seems to me that the goal there would be to reduce that, would be transparency, as opposed to blocking this family. Those would be my thoughts.
Yeah, thank you. I appreciate that. Your next question I think would be good for Josh and Brett. Someone wrote to us, thanks for doing this and thanks for sharing your work. Any tips for reporters in small, somewhat under-resourced newsrooms who have to sell their editors and management on committing to the time, money, labor involved in getting this kind of data? Josh, you want to go first, or any thoughts?
Yes, I thought Brett was excited. Yeah, so I feel like this is kind of that question that always comes up, and I feel like every reporter who's ever got into this position usually has had to deal with this in some kind of way. I feel like everyone always tells you just, you do it. You don't tell them that you're doing it. You just kind of spit it. But I always feel like that's kind of the wrong kind of way to go about it. One of the things I like to do is, like, when I was reading Brett's story, I was like, I didn't think of putting these records together. I didn't think of making a request like this. But I've already seen someone acquire these records. I usually read something like that for research. It's how you kind of start your day, reading your beats. So when something like that happens, I immediately I find that paragraph that explains where they got this data or how they kind of put this together, and I file that FOIA request right then and there. I know it's not going to be perfect, but if you get lucky, you just ask for which specifically they had already asked for. Especially if they have it available, you might get it in 2 weeks. So you don't necessarily have to jump in, and then it's way easier to sell your editor if you're like, okay, well, I got this. I already did a pivot table. I see a disparity already. Or there's a DOJ report that says that this is happening. Can we dive in and kind of go into this way? But I do think, like, the best relationships with your reporter and editor is when you can come to your editor and be like, hey, here's a story, I'm thinking about it. I'm not exactly sure how to execute it, but I know it is harder, especially when there's not that resources. So sending that public records request as soon as possible. There's tons of records requests that I have that have come back that I don't know exactly how to use, but I know are going to come up again. Like, when is there not going to be another instance of police force where you all of a sudden you want to know, where did this happen? How did this happen? That's how you kind of do that quick turn investigation. You already had the data, it was already there, and then an incident happens. And if you're going to stay on the beat, stay in this place, you should just be filing those requests so that you kind of always have that option for something that might come up again on your beat.
That's a great point. And Brett, you did seem excited to talk about this, so.
It's a great question, and I really just can concur with a lot of what Josh is saying, with a couple minor additional points I suppose I would make, which is, don't overestimate the shambling nature of the agency that you're up against either. Sometimes at a small local paper, you might feel like it's a David and Goliath situation, but they might be overworked too. They might have insufficient resources too. They might not have the bandwidth to put together a coherent or big appeal. They might have someone who's sympathetic to your request. Any number of things is possible. And I think too often in these records requests, the requester either gets upset because they feel like they're being, like, the person denying their request is, just mean or trying to hide the truth or this or that. You don't know who's on the other side of that request. Just, you gotta make it such a reflexive habit. You just like, it's like shooting a basketball. You're just like, file another right to know request. Another one doesn't succeed. All right, file another one. It's not personal. Just keep filing them. You don't have to tell your editor before you file a right to know request. Get so used to it that you can just do it really easily, like getting your coffee ready in the morning, and then the other part of it would just be like, you do though need the editor's buy-in eventually at some point, and so it is important to be able to make a compelling case. I think for me personally, and this is just WITF, where I was working when I did this last story we've been talking about, that's a small newsroom. It doesn't have a ton of people there. It's not it has good editors, but it also like there's also a lot of daily commitments. So you just have to be able to forge that relationship with the editor. And if you can, look for things like fellowships that can give you a real mandate. I was working on a fellowship that year, a Rosalind Carter Fellowship. So it's like, oh, I have to turn this story because I told them I would, and because you agreed to it, so like things like that can get the buy-in from the editor. If you just always take the story the editor hands you, then that in a way that's kind of your responsibility now.
That sounds great. That's great advice. Another question here for the panel or for Terry or the reporters. But someone asked us last week, the Wall Street Journal reported that as many as 1 million patients fall in the hospital in the U.S. each year, sustaining fractures, cuts, and internal bleeding, extending their stay in the hospital at a cost researchers have estimated in the range of $35,000 to $65,000 per patient. I had one of those falls due to hospital negligence and suffered a traumatic brain injury. My question is, how might I obtain records on the number of falls at the hospital, since I have heard enough from other patients to believe there is a pattern and practice of negligence in protecting patients from falls? I believe this is a systemic problem throughout the hospital industry, and I intend to write an article to jumpstart reforms.
Well, from my perspective, I would think of this in a couple of different ways. I would think that a hospital, for its certifications, would have to report the number of falls each year in aggregate data, and I would be first, on the records front, I would be looking at the Department of Health. However, what I would also be looking at is filing a Federal Freedom of Information Act request with the Department of Health and kind of work backwards, because I'm sure they have statistics on I would think, on the number of falls that occur at hospitals. And there's a lot of places that has to be reported. But before I dived in and started to do that, I would try to find somebody in your circle that is a hospital administrator, family member, friend, somebody, college buddy, somebody that knows somebody that can explain how the system works, so that if there is a fall, who is reporting it? Is it the charge nurse? Is it, how does that work internally, so that you understand that and know how to better craft your right to know law request when you go to the Department of Health? And think about it from the county Department of Health, as well as the State Department, and then of the federal angle of that as well.
Those are great resources, and I'll drop some links in here that Melissa Molesky from Pennsylvania News Media Association. She's a frequent resource of mine. I think Brett mentioned her before. She gave me some helpful links too, so I'm going to drop those in here that might be useful. And then another question was, Terry, do you have any advice if an agency says they don't have the record and you are convinced or believe or have reason to believe that they do in fact have the record?
Well, here's when I first started the Office of Open Records at the very beginning in 08, 09, when the law took effect, we were getting scores of responses from agencies that said, we've looked and no records exist. So even though the law didn't say we could do this, we did it, and the courts backed us. We had them do an affidavit under the penalty of perjury that they searched in good faith and that the record doesn't exist. And so let's just plain speak this. If an agency wants to hide a record, I think they're probably going to be able to do that. Now, when you get down to filing an affidavit and signing your name to that, I think that's where folks get a little nervous. They're not as willing to just say, oh, we don't have it. So when you request a record and they tell you that, appeal to the Office of Open Records. the Office of Open Records will require them under their burden to do an affidavit under the penalty of perjury that they did search in good faith. And also, under the law, it's not enough to just make that conclusory statement. You actually have to be able to demonstrate it. And I've won many cases where the agency has not been able to demonstrate that. They merely say, oh, this is, we searched and we don't have it, and here's the affidavit. But probably the practical truth is, if you believe an agency has a record and they did the affidavit, which is probably rare, but you're going to have to be able to come up, if you're a reporter, with a source or someone that can give you the record that you believe that they have.
And then Josh and Brett, question from the audience. Did those agencies, counties that gave you the requested data find your stories helpful to them in understanding the bigger picture of their agency challenges? If so, is that something you can point to when dealing with reluctant agencies?
No, they didn't thank me for doing the work. It was but I think that they know a lot of the problems, like a lot of these things are not new to them when we're doing the reporting. But they're more reluctant after you get the data, you actually do the story and put it together. So I'm not going to say it's going to make your life easier by exposing something like this.
Yeah, I didn't hear much of anything from the county agencies, from the county jails. They were pretty non-participatory, which was a bit frustrating. I had one former cabinet level official, who I will not name because the conversation was just not on the record, say that the story did a good job and was balanced and everything like that. So I know, and that's where it's important to just don't. If you don't hear a lot back initially, your story is having an impact. It just kind of sometimes takes a while. And with investigative work, you're not always going to have someone come out and say, good job, you led to this change. Sometimes it's like really hard to prove that, your story made a difference. But I know those agencies, those county jails all read the story.
Mm-hmm. Yeah, we have a quick question. I think this is pretty easy to answer. Someone wants to know, does Philadelphia's law work the same way as PA? And Terry, I think the answer to that is it's the state.
The Pennsylvania law would govern the city of Philadelphia. So the city of Philadelphia, no agency in the Commonwealth can have a law related to public records that is different, meaning weaker than what the state law is. And if you do, I will say that if you go to the Office of Open Records, their website is a treasure trove of information, of help, of forms, and frequently asked questions. And the current executive director and her team, Liz Wagenseller, and her 20-some appeals officers really do have a great deal of information out there for you.
Okay, great. Well, I think we're coming up to 7 o'clock. I really appreciate all of our panelists, all of our guests tonight. It's been a real pleasure. I know I've learned a lot. I think I've been a little inspired as well to keep on keeping on, as they say. So you can find out more of our events at spotlightpa.org/topic/events. Any questions or comments can be directed to Yasmin, who organized everything today, at ypiper@spotlightpa.org or at events@spotlightpa.org. And thank you all so much.
Thank you.